Many systems, in fact, all systems, were mandated to do community health needs assessments. What I'm proud of is that this system has put these needs at the center of our strategy. So the items that are identified as of great importance are diabetes and prediabetes, high blood pressure, depression/suicidality, and prescription opioid misuse. We have system-level goals around each of these items that, by the way, generate no revenue for us for the most part. In fact, they're often a big cost. But our commitment to the community, our commitment to the future, it tells us from the inside out that this is really what we're meant to do. Enormous effort and focus. Let's take opioid misuse as an example. In our opioid community collaborative, we currently have about 300 people in treatment at any given time. We've committed $3.5 million over 3 years. We have an use-only as a directed educational program. We have prescription drug boxes that have collected 11,000 pounds of prescription medications, 5 tons of prescription medications. We do physician and patient education. And naloxone is that reversal drug when somebody has had an overdose that can save their life. Very expensive and historically only available by prescription. We provide it at very low cost or for free and without a prescription. These are human beings. So this story is meant to remind me of a couple, both of whom were addicted to opioids, whose 14-year-old boy was taken away from them. As they went through the community collaborative and got clean and got healthy, they were able to get their son and their life back. This is all very real stuff, and I'm proud of what my colleagues, my fellow caregivers are doing, and I thank all of you for your collaboration as well. So no one can do things alone. So as we seek to make our communities healthier, Intermountain is big and we're strong and we're well organized, but we neither can nor should we do everything on our own. And we're very pleased to work with a number of others. So we make community contributions, last year to the tune of $13 million. We give grants last year to the tune of $4.5 million. And we work with community partners to the tune of about $650,000. The money is important only because of the human lives that it helps. So the Association for Utah Community Health, I guess commonly known as OUCH, provides support to 15 large independent community clinics. We've provided some money to help with community health workers, about $1 million. One of my favorite programs is this idea that we know that in a high deductible environment, there are many people who become functionally uninsured because they can't pay their copays. This program looks at patients regardless of who their payer is. It's not just for select health patients. Helps them get to a different tier so they can afford their health care more effectively and puts the power back in their hands. So we did mention the figure of $420 million of charity care. I want you to know that's 250,000 people that we were able to make their health care better despite the fact that they didn't have the money to pay for us. And that we, on an annual basis, reached out to our communities to listen to the patients and the community leaders about how they think our charity care policy should be formulated. So this is not something we do just on our own. This is something we do collaboratively. So some of our activities are actually in schools. We have 4 community clinics that we run, charity clinics that we run, and we support another 48 others economically, as well as with personnel and supplies. So Mars is a kid who, his school nurse at their school clinic noticed that he looked poorly. He was losing weight, he was thin, he was listless, he was pale, and she saw him at school right at the point of contact. She discovered that he had diabetes. She made the appropriate referrals. He never got really sick. Things turned around, and this is Mars today, a healthy kid. We've had 450,000 of these kind of visits that have occurred in our community clinics, either ours or clinics that we support in the last year.